Hi, everyone. I'm Mark Plaster, Senior Executive Editor of Emergency Physicians Monthly, and you're listening to EP Talk, the place where emergency physicians, aka ER docs, come and talk about things that are important to us. And sometimes it's personal, usually professional. Every now and then it's political, but not today. We're talking about innovations and new ideas in emergency medicine and things that affect us as emergency physicians. And my guest today is Dr. Anna Fitch Courie, and we'll get to her conversation with her very shortly. But first, we have a word from our sponsor.
As a healthcare professional, you have to make hard decisions for your patients every day. You work with public safety, EMS, fire, and 911 to save lives. And this time-sensitive collaboration requires staying connected. That's why FirstNet, built with AT&T, supports healthcare with timely and reliable communication that makes all the difference in caring for your patients. Here are some ways FirstNet is there for healthcare professionals like you. You get priority connection to the network. That means uninterrupted, real-time communication that doesn't compete with commercial traffic. You can connect with on-scene first responders and get vital information before a patient arrives at the hospital. When data is stored or transferred, it's encrypted and HIPAA compliant, so you can feel confident that patient information is protected. Agency-level plans are available for healthcare organizations and individuals on your personal line of service. Learn more about what FirstNet can do for you at firstnet.com/healthcare.
Hi, everyone. We're back, and Dr. Courie, I'd like to kind of let you introduce yourself to our audience and a little bit about how you came to this place. You're wearing a shirt that says FirstNet, but first, I want you to tell us about yourself.
Oh, thank you so much, Mark, for having me here today. I'm super excited to be able to talk to your audience because it gets to take me a little bit back to my roots before I came to FirstNet. Long, long time ago, when I was a very new nurse, I started out in bone marrow transplant, ICU, and emergency room float nursing. So when it comes to the other end of the spectrum with disaster response, when victims come to the hospital system, those were my roots. That's what began my career in. How do you deal with people who are experiencing the worst day of their lives and try and get them back on their health and wellness journey to where they were and have
Yeah.
a good outcome and recovery from that experience? I went on in my career to work with the U.S. Army as a civilian and contractor in community health improvement planning for operational professions. And that's really what led me to FirstNet after that is public safety, emergency response, disaster preparedness is an operational profession. It's how we use our bodies in service to others in when disaster strikes and taking care of our populations and our communities. So that's the full arc of beginning in the hospital system, dealing with that emergency intensive care situation, moving towards the Army, and now working with first responders, emergency response personnel, and how do you take care of yourself in light of the work that you do for your communities?
So explain then what FirstNet is.
Right, I know. I mean, many people don't really know what FirstNet is, and it
How is it
really
related to AT&T? That's what I want to know.
exactly. So what does AT&T have to do with FirstNet and vice versa? And really what we have to do is walk the dog all the way back to 9/11. And so I want to paint the picture for you, if you will. If you remember 9/11, which most of us do,
Yeah.
is it was a tremendous tragedy for our nation. And it wasn't just 9/11, it was also DC and it was Flight 93. And what
Yeah.
was going on, if you think back to the technology situation at that time, people were just beginning to use cell phones at a significant rate. But networks, that cellular networks were commercialized, right? So
Right.
even our first response personnel were using the same commercial networks to try and do the jobs that they're doing. And what the post 9/11 commission found that there was a loss of life because of communications failures.
Yeah.
And consequently, Congress mandated the First Responder Network Authority and charged it with building out a standalone broadband platform built with and for first responders, dedicated to public safety and response work. So there wasn't that competition on the network between loved ones trying to reach out, just
Yeah.
as they should, to find out what's going on in the middle of a disaster. Well, concurrently, first responders, emergency personnel are trying to connect to find out what's going on, ground zero, where the
Right.
accident or disaster has occurred, and then communicate back again to the healthcare system so that we can improve access to care, reduce the
Okay.
wait time for those patients getting
Sure.
the
Sure.
care
Sure.
that they need.
Sure. Okay. Let me ask you now what that looks like. Is that a second phone that somebody has, or is that a just simply from the phone that I have? I enter that network through that phone.
Absolutely. So that's a great question. It's actually a different SIM card. So it is a different phone. It's a different card so that only those who qualify for FirstNet can connect to the network. So that
Got it.
SIM card is how you connect to different networks.
Okay.
We now, an individual who qualifies for FirstNet can get that card on their personal phone. Many times it is agency sponsored. So if you carry a cell phone as a part of your work with an agency or an organization or a healthcare organization can adopt FirstNet and have that SIM card on their agency phone. So it is the phone that's given to those physicians or nurses or emergency room personnel so that they can connect to the network as a part of their day-to-day jobs.
Okay, but would that okay? Let's say I was identified as one of those priority kind of providers, and I got that SIM card on my phone. Would I also be able to make my standard phone calls and do all the other things
Yes.
that I would do?
Absolutely, absolutely. I mean, I carry FirstNet on my device, and it functions exactly like what you expect from your personal phone. There's added capabilities into that so that when
Okay.
there are outages in the middle of a disaster, those individuals are going to get what's called priority and preemption. That means they're going to be uplifted so that they are always on and able to respond in the middle of an emergent situation. In addition, AT&T has committed as a part of this public-private partnership that in the event of those incredible
Sure.
tragedies that take
Yeah.
over the network, they will ruthlessly push off commercial traffic so that disaster response personnel, first responders, emergency personnel will get that uplift so that they have priority on the network. It's kind of like if you can visualize a 6-lane highway of
Yeah.
different traffic driving along the interstate. And if something happens, it's just like the sirens go off and everybody who needs to respond gets pushed forward in that line of traffic,
Yeah.
and everybody who's not needed in response kind of gets pushed down. So
It's kind of like
that's
having
a good visualization.
it's kind of like having an ambulance only lane
Yes.
in a highway so that everybody's bumper to bumper and there's stopped traffic and suddenly the ambulance goes flying by everybody in the dedicated side lane and that's the idea. Do you have to okay I'm showing my phone. Do you have to actually do something to you? Let's say I've got that SIM card. Do you have to actually do something to get into that system, or it's you're in that system all the time?
The SIM card activates you into that system. So when you are actively on FirstNet, if you, whatever carrier you have on the top right hand corner of your device, it will actually say when you're on FirstNet. It pops up as you're on FirstNet. But because you can be on also the AT&T network as a part of that agreement, sometimes it'll show AT&T and T and sometimes it shows FirstNet, depending upon where you are and how you are being uplifted into the system.
But
But
it
you
would
don't
have
actually have to do anything. Like I don't have to put in a PIN code
okay.
to access
Yeah,
FirstNet. No,
that's what I was
it's part
actually
of my
asking.
device.
But I would have to have AT&T rather than Verizon or any of the other carriers.
Right. It is FirstNet is built with and for first responders, only for first responders. So you have
No,
to
no,
have
no,
a FirstNet account.
but you have to have which is an AT&T account. So my private
Correct.
my private phone would have to be through an AT&T account.
Correct.
Got it.
Yes.
Got it. Got it. Interesting. Now, I understand though you're doing a whole lot more than just providing, broadband emergency care. That would be more of a technical part. Why do they have someone who has a doctorate in nursing? How is that impacting it?
It's the elephant in the room, right? What does a telecommunications company have to do with health and wellness, right? And if you'd asked me, 25 years ago when I got my degrees, if I could speak about cellular networks, I would have laughed at you. I never envisioned the any sort of scenario where we could talk about band 14 and a standalone network and all the devices and technology associated with it.
Yeah.
Um, but I have worked my entire career in health and wellness, as I mentioned, in operational professions, tactical professions, and what FirstNet has realized. So when there is an emergency response, FirstNet will deploy mobile communications to ensure that connectivity for those emergency response personnel. So if you think about a hurricane, a wildfire, or a tornado, or other man-made disaster where communications could be affected either by too many people or downed lines, we have what's called a response operations group. It's made up of former first responders, and they drive into the middle of a disaster to work boots on the ground with those public safety personnel, hospitals, to make sure that they have their communications no matter what's going on.
Right.
And as a result of that relationship, FirstNet as a business started seeing the incredible impact and chronic stress of constantly driving towards, running towards those disasters, and meaningfully wanted to do something about it. They felt that something needed to be done from an advocacy point of view, from a resources and partnerships point of view, to address the mental health and wellness of emergency personnel nationwide. And so, consequently, in October of 2020, we stood up the FirstNet Health and Wellness Program, as well as the FirstNet Health and Wellness Coalition. That coalition brings together over 28 national public safety and emergency management associations and their
Mhm.
C-level leadership. We represent about 5.1 million emergency responders nationwide to address the health, wellness, and readiness of American first responders and their families.
Now, is that the people who are already involved in FirstNet? FirstNet has that many responders, or this is something that's kind of a part of that whole push?
Exactly. So it's a mix, quite honestly. We committed to all first responders nationwide, whether they were on FirstNet or not. We feel
Got it.
that the work that they do to support their communities is significant enough that we owe a commitment to those who serve us in a similar way. There are components of my program that support FirstNet customers specifically,
Yeah.
just as the nature of how the strategy was designed to be comprehensive. So, for example, when we're talking about FirstNet customers alone, those agencies, no matter how big or small they are, can request a therapy dog if they've experienced a traumatic event, and we will get them a therapy dog to support their peer support responses and critical incident stress debriefings following disaster.
Sure. Sure.
That is a benefit, if you will, of being a
Okay.
FirstNet customer, and just one example. Now we have other sponsorships that, regardless if you are FirstNet customer or not, we have committed to supporting trainings that support your health and wellness. So we sponsor nonprofits nationwide to provide um, training, education, and cultural transformation in departments to address things like post traumatic growth, stress management, resiliency, physical fitness, suicide prevention, and a number of other different priorities that the FirstNet Health and Wellness Coalition established as a part of how we came together, how we were going to identify What is it we're trying to address? What is it we're going to try and improve?
And this is just, if I could plug, this is just that takes funding to do that, and that's just a goodwill on the part, good neighbor on the part of AT&T to fund that and to reach out obviously it's good for business, okay?
Yes.
And I'm not naive to that. When you're a good neighbor and you take care of people, then people do look to you for as a vendor and as as a business partner, so to speak. But if you're doing that in advance of any kind of business relationship, that's kind of an interesting approach to say we're going to do the right thing and take care of our first responders. If they become our business partners, then that's great. We'll do even more. But right now we're just going to reach out. We're going to help. We're going to build a network for our folks and open it up to everybody. That's a that's being good neighbors, but it's also good business.
Well, and I think one of the things that many people don't realize, the FirstNet built with AT&T is a 25-year public-private partnership, that business agreement between AT&T and the federal government to build out the network. My program is not included in that contract. It is completely at the belief of the leadership at FirstNet that this is the right thing to do. And
Yeah.
so I'm in a very interesting position as a healthcare professional in the organization, working with technical experts, working in obviously a network build out, but they have so been open to learning the public health process, the health promotion process. How do we do community engagement? How do we do community improvement planning? That it's kind of become a part of who we are as a business. It was part of our commitment. We told first responders when we were awarded the contract that we would be there for them. And for FirstNet, the FirstNet Health and Wellness Program is our opportunity to live out that commitment in a different way, and something
Yeah.
that our employees are very, very it fills them with pride. It fills them with a sense of purpose. It fills them with a commitment that we are doing more than what we said we would do in the contract.
Yeah, yeah. Well, I will tell you something though. That's what makes it very confusing about when you say, what does FirstNet do? And it's obviously a telecommunications network. And then
Yes.
when I started hearing what you were doing, I said, well, which is it? I mean, is it a telecommunications network so that you can have community support? No, that's really not. It's actually the community.
Right? When
Right.
things go wrong, it's not just the ambulance that shows up. It's coordination
Right.
between fire, police, EMS, the healthcare system, right?
Sure.
So that interoperability between those systems is one of the incredible assets that FirstNet brings to the table, right? It brings those diverse, multidisciplinary programs to a communications platform so that they can seamlessly interact over that network independent of what device that they're using. Okay. In that ecosystem, it also includes an app catalog. And that means what applications meet the end to end security requirements of FirstNet and make your jobs easier, whether that is on the healthcare side of the house when we're talking about Pulse Point or AED applications, or I'm trying to think of some other ones. We have a number of different ones in the healthcare space. We also on the fire side use an application called Z Access, which identifies where responders are, not just on XY axis, but also on Z. So if they're inside of a building, they can sense where that individual is in case they need rescuing themselves. So there's that app catalog. They've all been insured for the security requirements. They've all been vetted and assessed to meet a specific need of public safety. I'd be remiss of not mentioning that we also established a health and wellness category in the app catalog for FirstNet that addresses the health and wellness needs of responders. So again, your device is with you wherever you're going,
Sure. Sure.
wherever you live, work, or playing. So let's enhance that device. Let's make it adaptable and flexible so that maybe when you have downtime, you can address your health and wellness utilizing your devices, right? So network, app ecosystem, and then we have I think it's about over 150 deployable assets that range anywhere from a blimp, which is FirstNet 1, that has a cellular
Okay.
uh, connectivity on a blimp. So thinking of the
Yeah.
Olympics, thinking of Boston Marathon, or a major concert, presidential, you can get FirstNet 1 can come in and be in that range to ensure that there's cellular connectivity for those responders.
Gotcha.
In disaster, wildfires, tornadoes, hurricanes, we have SAT Colts and CRDs. SAT Colts are actually those large trucks with the cellular towers on them so that they can drive into the disaster. A CRD is a smaller mobile cellular unit that can actually be popped on the back of a 4x4 truck and again driven into those remote, hard to reach places where those firefighters, EMS personnel, your ski patrol, those individuals still need to be able to connect wherever they are, whenever disaster strikes. And those 150 deployable assets, when you are on FirstNet, just like our therapy dog, those are things that you can request for deployment when things are going on, whether it's planned or unplanned.
Uh, the scope of this looks massive. Okay,
It is.
I'm because you start talking about the kinds of prioritized communications that occur under stress. I'll just even call stress, not necessarily disasters, but stress circumstances. Okay, where people have to they can't be subject to the jammed lines. I've been in situations where you have 100,000 people there, and something happens. You try to call and connect with somebody. Done. You can't do it. So I can imagine that having a system like this would be incredibly important. I want to know the scale. The government is doing this. How big a program? How many $billions are they putting into this?
I actually don't know that I can answer that question. That's not a number I've actually personally looked up. I feel a little embarrassed to say that.
That's okay.
So I would have to go to Google to look at the investment in the network itself. So I'm gonna take a polite pass on that question,
Okay.
just
Okay. Well, I'm
because
just
I
curious.
don't know off the top of my head
Well, I mean,
what that number is.
I
And
mean,
so
it's just huge.
yes.
It
Well, and I think that one of the things from the healthcare field perspective, if you're thinking the massive scope of this, think about how COVID-19 was a disruptive innovator and really advanced very quickly. We see in healthcare all the time how quickly advances happen because of technology, right?
right.
And when COVID-19 happened from the healthcare space, they really had to figure out how do providers connect with patients when we are prioritizing COVID-19 patients in a intensive care space and emergency in the emergency rooms to and ensure that patients still get that patient care that they need, especially our chronic illness patients. FirstNet was able to step in a lot of those. They were able to help out with pop-up COVID testing sites. They were it brought that connectivity to the mobilized healthcare system that resulted from COVID-19 in a very, very innovative way.
Fascinating. Fascinating. Wow. You've taught me a lot here. This is pretty crazy. Now the question here is, emergency physicians may not know a whole lot about FirstNet. This I think is probably a relatively new concept, and yet we are probably near the pinnacle of the top of requiring this kind of system. What Without being too commercial about it, I mean, how does a emergency group that says we want to participate in this, how would
Mhm.
they go about it? I mean, just Google FirstNet and say, we now have emergency physician groups that are in the hundreds of physicians, and
Right.
obviously in a natural disaster or God forbid, a military type, situation, that we would have to be able to communicate with one another
Hmm.
as a priority. And
Yes.
so, what would be the steps that a large group like that, who wanted to put their docs on that net, what would they do? Just, I mean, FirstNet has a sales
Absolutely.
force.
Yeah. So there's a couple of different ways. And I think the first thing I would say to emergency physicians, emergency nurses, anybody in that emergency room is start seeing yourself as a part of your community's emergency response plan, your disaster response plan. One of the
Yeah,
reasons I think the healthcare system really kind of struggles with, well, why are you talking to me about FirstNet? Is that they don't always see themselves as a part of that entire continuum of disaster response. They see
yeah,
here in first responder and they think fire, EMS, and law enforcement. When the tragedy, you've got the victim on the ground, whatever ground zero is for that community, and they need to see themselves as a part of that connection from that point to where that victim gets into the hospital or the trauma center. So that's kind of part one. I challenge emergency physicians to see themselves as something really important for their communities and how they're a part of that interoperability to keep our community safe and protected no matter what happens. So that's kind of challenge one. So connecting, right? Part two, there's a number of different ways that physicians can join up. As an individual, which is called subscriber paid, you can go to your local AT&T store. You can go on firstnet.com and you can chat with an individual on the phone, on the net, on the website, or in your AT&T store if you're an interpersonal, person
yeah,
and want to
yeah,
see
yeah.
a face, right? They can
Sure.
walk you through that steps of getting that SIM card on your personal device. Healthcare organizations can qualify for FirstNet uh, when they through the scope of their emergency preparedness plan. And so that agency can work with a FirstNet consultant to find and devise the right plan from an agency paid. That's where your agency pays for your cell phone
Gotcha.
in the emergency room to be available. And that's what a lot of agencies are doing. If you think about being on call and you have to get called into the emergency room because there's been an uptick in people coming in and they don't have enough staff on call or on site, you may get called in, right? So you want somebody who's always on, always able to connect. And that's where that agency paid device comes into play.
Gotcha. Gotcha. But I see though that, most of us in emergency medicine are kind of worst case kind of people. We've seen disasters. We've seen a Las Vegas shooting. We've seen building. I mean, frankly, as horrible as 9/11 was, to escape with only 3,000 dead was just a matter of the timing of the day and everything else. And the impact site on the buildings. If those aircraft had succeeded in getting lower and had struck the towers in the first 40 stories instead of 80 and above, um, you could have lost 30 or 40,000. Or if it had been a different time of day,
Yep.
or if the buildings had not come down straight, they collapsed straight instead of falling like trees. And so there's just a lot of things that we think about that. It's horrible to say this, but in some ways we dodged a bullet. I mean,
Mhm.
because 3,000 is terrible, but it had to put when I saw those towers fall, I was thinking in terms of 30 or 40,000 people,
Oh,
and
absolutely.
I was actually shocked that the number was as low as it was, um, and we're not talking about nuclear explosions. And I think that in this day and age and the instability of the world, it's not it's not chicken little thinking to be prepared for a nuclear attack. To be perfectly honest.
Unfortunately,
And
yeah, that's the world we
people
live
don't
in
like you
is
talking about it.
preparedness matters.
Yeah, that people don't like you talking about it because they think that, oh, we should not talk about these things because It normalizes it. Well, I'm sorry, but this is what we do, and we need to normalize it. We need to have preparation for this. And you're absolutely correct that in a situation like that, communication, the normal communication would go to ground. I mean, we would just have no capability whatsoever. And I think that FirstNet, the importance of people being involved and understanding and getting involved is increasing every day. And I think what you're doing as far as health and wellness is incredible. But I think number one, the priority is get involved so that you can actually communicate in situations that you need to communicate. So that's crazy. Take me a little bit more into what you're doing exactly with health and wellness. You talk about therapy dogs and such, but
Yeah.
I suspect it's a whole lot more than that.
Oh, it's a portfolio. Honestly, it's a whole strategic way of looking at health and wellness. And I kind of like to start with my own personal philosophy about health and wellness and what is nursing, right? And what is healthcare? Healthcare and nursing and medicine are entering into that sacred space of caring for individuals and communities wherever they are on their health and wellness continuum, whether that's birth to illness, to injury, to abuse, all the way to death, right? How do we have a meaningful quality of life in spite of what happens to our bodies sometimes, right? So entering into caring and compassion for that individual, bringing evidence base into that conversation about what is the best way to treat and care for this person or this community when they're faced with these situations. So if you start with that framework of how do we care, right? And also take into the challenge that health and wellness can weave itself through all aspects of any organization. I'm not just
Right,
talking FirstNet. I'm talking we're healthcare, business, technology, education, politics, you name it. There's a component of health in everything we do in life.
sure.
And it's how you see it. It's how we talk to each other. It's how we're compassionate, interact with each other. It's the programs that we support. It's our commitment to each other. And so that philosophical base, if you give me my soapbox minute about health and wellness, is very, very important to my program because it starts with a commitment to be there. It starts with that commitment to care for each other, and that health and wellness is a part of that
Yeah,
dialogue.
yeah,
So we have that FirstNet Health and Wellness Coalition, and that's not just me facilitating a group of people. This is a group of leaders across national public safety and emergency response associations coming
yeah,
to the table, Fire Protection Agency, International Association of Fire Chiefs, National Association of Emergency Medical Technicians. We've got the American Nurses Association at the table. These are leaders committed to the health and wellness of their people because they know without these people, our communities would not be well. It
yeah,
is it is a symbiotic relationship to how well our physicians, our nurses, our emergency responders are to our overarching community health. And that's
sure.
why we're committed to it. That coalition drives from a governance perspective how we sponsor nonprofits working in that innovative space that's not quite public sector, not quite private sector, but has
Sure.
the means and the drive to implement evidence based practices to address suicide prevention,
Right.
post traumatic growth, stress management, physical fitness, human performance. And taking really that nonprofit space is a great place to take the academic research component and translate it into real life practice. And so it's a fantastic opportunity for us to be able to support those efforts. We talked about technical solutions, right? So how do we make people's lives easier by entering into health and wellness? Because whether you like it or not, devices are not going away. If anything, the future vision is more virtual reality, more augmented reality,
Yeah,
more connecting with people over networks. And so we want to make that meaningful. right? So we want to make that makes a difference in people's lives so that they can make choices and behavioral change that leads to their own individual wellness. Because when we care for ourselves, we care for others better. And
Yeah.
interchangeably with that, if you read the works of Dr.
Physician heal thyself.
Jasiak and Mazzarelli, who talk about the more we lean into caring, right? The
Yeah.
more we the more we live out our purpose of why we became healthcare personnel, we're going to be better. We're going to be
Yeah.
more
Yeah.
whole, more well. Yes,
That's
yes.
great. That's great. That really rounds out this discussion, which is really fascinating to think about something as hardcore technical and also having what do we say, high tech, high touch aspect what you're doing. It's fascinating, and I think that our listeners, our viewers, I think finally catch that, and they see your enthusiasm and your caring, and maybe they're understanding that, hey, this is not just a high potency phone SIM card that I've got or a high priority communications tool, but it's also a organization, a network that looks at my health as well. So
Absolutely.
I thank you so much for coming on EP Talk and talking to our folks about that. And
Yes.
if you're
I would be remiss if I did not tell your audience on the line to check out if they would like more details. I believe it's going to be in your show notes. We've developed an ebook called "Connecting Healthcare When and Where It Matters Most," and it's going to dive into the nuts and bolts and sausage making of what I just discussed, but really puts solutions in their hands that can help them with making the decision.
That's great. That's fantastic. Thank you. Thank you. So, for our viewers, if you'd like to know more about FirstNet, obviously it's straight on the web at firstnet.com. Is correct?
That's correct. Firstnet.com.
FirstNet.com. FirstNet.com, and then you could look at the ebook there as well. So, everyone, thank you for joining us, and Dr. Courie, thank you for joining me today, and we look forward to further conversations about this. See
Thank
you,
you so
everybody.
much for having me.